For the next 30 years, the number of people on the African continent is expected to double from 1.2 billion to 2.5 billion people.
And Nigeria, currently the most populous African country, is projected to overtake the United States to become the world's most populated country after China and India by 2050. Topics surrounding family planning still remain a taboo in different parts of the country.
Now, the theme for this year is based on safeguarding the health and rights of women and girls, especially during this time of coronavirus pandemic, when billions of people have been on lockdown and the rate of conception has been projected to hit the roof. All right, joining me now via Skype is RHONDA Robinson, Executive Director, HACEY Health Initiative. RHONDA, good morning. It's good to have you join us right now.
Good morning, Mike. How have you been?
Right. Now, the point there is when it comes to the numbers, the population numbers hitting the roof, and especially in Nigeria, one would say is scary. Others who see from the economic perspective will say, well, it's something we can harness. But what are your concerns generally?
Okay, thank you, Mike. I think one of the greatest challenges we have to address when you're looking at our population, impending population boom, is the fact that we do not have enough resources to actually cater for this boom. And there are other interrelating factors that would limit us from actually maximizing the potential that our current population is actually providing. When you're looking at population boom, you have to consider access to birth control, you have to consider access to quality education, you have to consider access to healthcare. What does this look like in Nigeria currently? And what do we need to make sure that in the next 10, 20 years, we can actually fully provide services for those who are currently underserved? And I'm talking about those that are mostly in the rural and underserved communities. Up to 70% of Nigeria's population live in rural communities and underserved communities. And we have to look at our projections in this area as well. Everyone is talking about the current COVID pandemic and looking at the health effects of it. And we should also consider how this is affecting people who are stuck at home, young people who do not have access to basic amenities or jobs. And we should see how do we plan for the future? How do we plan to build for
All
a
right,
better
RHONDA, before we look at how to plan, help us better understand how the COVID-19 has impacted or rather affected persons who should have access to this basic education with regards to perhaps family planning and the likes to help when we are talking about population explosion.
I think to answer that, you would need to first consider what the effect has been on people who used to have access to basic contraceptive services and products. During the lockdown, a lot of people could not renew their subscription. A lot of people could not access information and counseling service. And it was very difficult for them to continue using protection or using birth control during those periods. So this increased their susceptibility to unplanned pregnancy. Now, Nigeria has a very high percentage of teenage pregnancy. So when you're looking at that aspect, when already the infrastructure does not support them accessing these services, you now find that during this pandemic, when there has been lockdowns, there has been curfews, there has been a reduction in the availability of these products and services, you find that this has a tremendous negative effect on their sexual and reproductive health.
All right, moving forward now, if we have to look at deliberate steps to be taken, I wonder what kind of policies you'll be expecting to see at this time. China has been a very, a ready-made module for everyone to see when they adopted the one-child policy, and now it is two-child policy. I wonder, because in the 80s, the government of Nigeria at that time was considering the possibility of looking at 4 children per family. But Nigerians kicked against that to a great extent. But what can we do deliberately right now?
I think sometime, early last year or late last year or so, the discussion came up again. And one thing we have to consider is that when you're talking about reducing birth rates, you have to be looking at the infrastructure that is available to provide those services. Right now, more than 50% of our population does not have access to modern contraceptive services. So you are proposing solutions that you don't have the infrastructure to actually cater for. A lot of women do not have rights over their own bodies to actually say when they want to actually start giving birth or how many children they want. So you have to look at it at a step-by-step basis. So you need to start looking at policies that give rights to women, and then you need to start looking at policies that strengthen the health system to be able to provide these services and provide these commodities to people. And then you need to start looking at services that use some kind of tax shifting, so that you have more facilities that offer these services. In countries such as the UK and in China, you have birth control and facilities and contraceptive facilities at every point. So right now, you have very few primary healthcare centers that actually offer these services to young people, just to start off with. So if you're looking at things like that, you need to start building up the structure that will support solutions like that. Otherwise, anything you're planning right now is not going to work. People will keep kicking against it because the infrastructure to even provide basic health services is not available.
All right, but year in, year out, Rhoda, we celebrate this World Population Day, and we keep talking about almost the same thing yearly. What really is the challenge with perhaps taking the steps to address these issues?
I think, as you said, every year we keep talking about it. Next year we will talk about it, and we will keep talking about it until we solve the problem. Excuse me. And one of the problems that we are facing right now is funding towards this. Our funding in Nigeria for healthcare, not to talk of sexual and reproductive healthcare, is very low. We cannot have a plan that does not have funding to support it. So we need to start looking at our fiscal policies, our financial policies, and our funding mechanisms that would feed into providing adequate sexual and reproductive healthcare for women and young people in the country. Until we can find that and look at that as a very important aspect, we'll see that we'll just keep talking about strategies, about plans, that at the end of the year, we look back and we've done less than 5% of it. So we need to start actually talking about funding these strategies. A lot of people have ideas. A lot of people have interventions that they want to run. The government also has plans. The Nigerian government has signed on to a lot of plans that look very good on paper. But when it comes to implementation, we have serious challenges with that. So we need to start taking a step back and look at what would it cost to actually fund this kind of ideas. And it's not just about the government. The private sector also needs to come on board. The non-profit sector also needs to come on board. So it is a multi-sectoral and multi-partner, multi-stakeholder process that needs everybody to be in line with the solution.
Okay.
Over the next 30 years, the number of people on the African continent is expected to double from 1.2 billion to 2.5 billion.
And Nigeria, currently the most populous African country, is projected to overtake the United States to become the world's most populated country after China and India by 2050. Topics surrounding family planning still remain a taboo in different parts of the country.
The theme for this year is based on safeguarding the health and rights of women and girls, especially during this time of coronavirus pandemic, when billions of people have been on lockdown and the rate of conception has been projected to hit the roof. Joining us via Skype is RHONDA Robinson, Executive Director, HACEY Health Initiative. Good morning. Thank you for joining us on TVC Breakfast.
Good morning.
Now let's look at this year's theme, talking about safeguarding the health and the rights of women and girls. I wonder how crucial or critical it is to, when we look, the focus is for this year on population explosion perhaps, and why it is important for us to have this kind of discussion.
Thank you. This year started off on our discussions on how we manage our plans for the impending population growth or projected population. Nigeria is expected or projected to reach a population of 400 million people by 2050. And this is a very large number, and we need to be able to control our population at this point. With the recent COVID pandemic and the lockdown, a lot of women and a lot of young people have their access to sexual and reproductive health care services and information cut off. And this has led to a negative effect when it comes to birth control and contraceptive access for young people, especially those who are in underserved communities. The population, you also have to consider that a lot of women who had initially had access to SRH services and second reproductive health services, including contraception, they did not have that access anymore because a lot of the resources in primary healthcare centers, in secondary health facilities, were diverted to addressing the COVID cases, leading to a very large gap when it comes to providing adequate services for birth control and contraceptive access.
All right, Rhoda, our people here are really very cultural and religious people. I wonder what you see, how is religion and culture helping in trying to talk to people and trying to get them conscious of population when everyone or most of the people see children and new children as an act of God, and that superstition, that superstition that they are attached to children. How is this helping or compounding the situation?
I think that's one of the things we need to put more effort on. Religious bodies, religious leaders are key stakeholders in changing the narrative when we are talking about population, because there's this cultural belief that children equal success, or more people use children as their sort of pension plan or retirement plan. You need to start changing that narrative. And when it comes to religion, more religious leaders and thought leaders need to be involved in the process of promoting family planning, promoting access to information when it comes to childbearing for individuals. So we need to have these discussions with religious leaders so that they can change that narrative.
Now, the state of primary healthcare centers have become a major challenge and concern to a lot of Nigerians, and this is where most women and girls can access perhaps education and information and every form of family planning methods they want to, use for themselves. How much of a challenge or a problem does this pose when we are looking at population explosion?
Now, I think the recent pandemic has shown how weak and fragile our health system is. We need to invest in strengthening our health system to be able to provide that services. Before the pandemic hit, we're already having issues in providing or meeting the contraceptive needs of young people and women. So now it's even more apparent that we need to focus on this thing. Nigeria is estimated to have an incidence of unplanned pregnancies going into the millions, and we need to be able to address this problem. And one of the solutions that, as an organization, we are working with the UNFPA is actually providing the services for young people free of charge, giving them access to counseling, facilitating their access to facilities where they can get the services. Because we have to understand that when we try and box in the facilities or agencies that can provide these services, we won't be able to meet the needs that currently exist. COVID has exponentially increased every negative factor or indicator that we have when it comes to sexual and reproductive health. There are more people who are involved, who are victims of gender-based violence. There are more people who are subjected to child marriages. You have more incidents of teenage pregnancies. And we need to start thinking forward. How do we address this problem? Partnering, investing in innovative solutions, strengthening the health system by putting more funds into that space. And one of the things that we can do to solve this problem. Last year, Nigeria was signed on commitments during the International Conference of Population and Development, and we need to start taking drastic efforts in implementing these solutions.
All right, thank you. Thank you very much, Rhoda Robinson, for your time on the program. We appreciate